All right, I think we're going to get this underway here. Thanks everybody for joining again. As always, everything we're showing here on this particular presentation is not legally binding or anything like that. It's all public knowledge, and we have harvested it together to present to you. If you have any questions during the presentation, please feel free to chat them into the window or raise your hand, and we can kind of get to those towards the end here. I'm going to introduce Roy Hightower, who's going to be giving the presentation today on the ICD-10 delay. So I'm going to turn it over to Roy.
Thank you very much, Dan. We'll begin with talking a little bit about the ICD-10 delay, and then get a little feedback from some of the vendors and what their plans are in terms of avoiding or mitigating risk associated with ICD-10 in terms of the EHRs. On the first presentation I did of this, we discussed a little bit of the history. We know that ICD-10 has been in use, has been published for about 30 years now. Other countries all around the world have already converted to ICD-10, and there's a substantial amount of disgruntled physicians and healthcare systems administrators who were ready for the ICD-10 to be fully implemented. However, as we know, the HR bill went through Congress, HR 4302, to protect access to Medicare. And a part of that was a doc fix, which is part of the sustainable growth rate, was set to reduce the Medicare physician payment rates by 24%. If that piece had not been tied to the ICD-10 delay, the bill probably would not have passed and delayed. There was also some other contingencies, as I was made aware. A very bright man mentioned to me that there are some voting issues going on with politicians who are trying to delay the ICD-10 implementation for political gain. Regardless of which party you're affiliated with, it did have an effect on the delay of the ICD-10. The sustainable growth rate was set by the Centers of Medicare and Medicaid Services, CMS, to control the Medicare spending on physician services. And so one thing that the impact of this bill has is that the doctors are still somewhat disgruntled about is the fact that that 24% decrease in payments is going to increase because this is simply a Band-Aid and not really taking care of the real issue with sustainable growth rate. So Congress introduced this doc fix to include provisions to delay ICD-10 to 2015 October. And the House passed the bill to postpone SGR delay on Thursday, March 28th, which was just a short time ago, and then the Senate passed the same bill on March 31st, and the President signed it into action the first week of April. Work's response is this: our clients don't need to undertake the financial hit of ICD-10 while also absorbing reduced Medicare fee schedules, and according to the ACA. That's the good news. The bad news is everyone still has to upgrade this year on all EHRs. The 2011 certifications expired on December 31st, 2013, and all of the new certified 2014 EHR systems must be MU1 and MU2 certified. In order to meet that certification, ICD-10 has to be implemented no later than the third quarter of this year, October. And to sum it up, Ben Burke stated that the ICD-10 delay at this point is a good tactic, but part of a bad strategy. I think that's very relevant. If we are going to change the entire landscape of healthcare, let's do the sensible thing and spread it out over a period of years, not a period of months. And I think that says a lot. Just with the strategy of meaningful use, spreading it out over multiple years, 7 stages, should apply to this ICD-10 also. There was some negative criticism about the delay. Several vendors are going to have to retest. There are some training and implementation funds allocated already, set up, plans put into place to train all of our physicians and eligible professionals how to code according to ICD-10. Shortcuts prevented more thoughtful changes in order to meet the deadline. And there are several students all over the country that are currently enrolled in these coding and billing programs that are preparing for ICD-10 that have never seen ICD-9. And so they're going to be shocked when they graduate this May and have to start coding in ICD-9 again. There were, like I said, many budget allocations for the execution of ICD-10. This may slow down sales, delay upgrades, and like I said before, the 24% in payments will increase if a permanent fix isn't implemented. This is something that was said by CMS, and I thought it was very pertinent to the discussion. Many vendors have acted in good faith and invested significant time, energy, and resources to comply with the deadline. CMS estimates that a 1-year delay of ICD-10 could cost between $1 billion and $6.6 billion. I thought that was pretty hefty when we're talking about the amount of money that it's going to take to delay. Some positive criticisms were this will basically avoid some cash flow disruption for now. There's going to be that reduction is definitely going to increase over time. So putting it off is going to be worse in the future. But for now, for the next year, it'll be good for physicians to retain that 24% in payment. CMS estimates that the early stages of implementation denial rates would rise if we were to implement ICD-10 today. They're thinking that there will be a rise of 100 to 200% in denial rates, and days in AR will grow 20 to 40%. If ICD-10 were implemented today, migration to ICD-10 carries a risk of translating existing policies and benefits and payment rules within the payer system. If we were to implement this, there would be a lot of negative ramifications. The delays in payments can also occur because of challenges in claim processing for the ICD-10 environment. Making sure that we have all the new codes implemented and that we want to make sure that the payers get paid accordingly. The programmers that I talked to look at this as a longer runway or time to actually get it right, meaning that they have more time to take care of the ICD-10 conversions and connecting them either to SNOMEDs or joining them with ICD-10, ICD-9, and other joint codes and CPT codes to get a consistent record. Others feel it's a good time to focus their energy and efforts on ME2 and ACO programs. Physicians are avoiding that reimbursement rate cut. And then all of the funds that were invested to be implemented for now can be put aside as reserves and earn interest for when the ICD-10 implementation really does occur. The Beacon Partners had a pretty good outline of their view, a positive view on this. And they said they would improve their clinical documentation workflows, develop a long-term coder strategy to help retain and incentivize their coders, optimize their revenue cycle, evaluate all of their computer-aided or assisted coding, continue their dual coding and training, implement a comprehensive system for remediation and testing. this is a pretty important one because I feel like with the rush, I know ICD-10 has been put off, but there are several quality assurance programs that probably could benefit from making sure that an apple is an apple and making sure that the codes transfer correctly. Focus on the physician education, both employed and ancillary. This is a good time for physicians to get better acquainted with ICD-10. Right now, I feel like many of them really don't know much about the code behind their vocabulary terms as it is, but they definitely will have to know some of the nuances of ICD-10 in order to get billed properly. So that extra time for training is definitely a benefit. So what are some of the vendors saying? I spoke with Ryan Donovan, the VP of Corporate Communications at Practice Fusion, and he says, as a result of this one-year delay, Practice Fusion providers will not be required to use ICD-10 codes in healthcare claims this year. However, it's still coming, so it's important for all stakeholders in the healthcare industry to become familiar with ICD-10. He also said that Practice Fusion is prepared to help providers and customers meet their 2014 deadline despite the delay. They'll continue to prepare well in advance of the 2015 deadline. And he's basically saying keep an eye out for changes. Allscripts, I talked to a few people there, and they basically said that the ICD-10 delay does not change Allscripts plans. They've informed their clients that everything's still on schedule and have been encouraged to upgrade as they originally planned to ensure that they're prepared. So they don't seem to think that the upgrades that include the ICD-10 code changes will affect their everyday practice. Greenway, I talked to Justin Barnes, and he's a VP of Government Affairs. He says that all he knows is that they're in full deployment mode and nothing has changed on their side. And they're encouraging people to focus more on the alternative payment incentive models such as accountable care organizations and patient-centered medical homes. NextGen responded by saying that this may slow down the sales and the delays and upgrades and the stability of the reimbursement under the Medicare participation rates. While it's not it's less than positive for a permanent fix, again, back to that thing that we're just putting a Band-Aid on this, it definitely lends more certainty than the short-term practice. Continued participation in Medicare by clients is a prerequisite to participation in things like meaningful use, BQRS, and value-based modifier programs. Athenahealth had a couple of interesting things. Ed Parks, I think, was the most vocal of all of the groups. He said it's unfortunate, and he was very disgusted in the tone of his writings that the government has once again chosen to delay ICD-10. Athenahealth and its clients are and were prepared for the ICD-10 transition. And in fact, we have a national payer data showing that 78% of their payers are currently providing readiness in line with the 2014 deadline. And then I had someone else, Michelle Mangino, respond with Athenahealth released our ICD-10 ready version in 2014, February, to all their customers. Because Athenahealth is cloud-based, all the practices receive new versions of software at the same time via the cloud. So no action is really needed. It's just simply a switch that they have in their system that they can turn on and off. And individual payer readiness and acceptance of ICD-10 codes. eClinicalWorks, Heather Coatta, she said from a technology standpoint, we have been ready, and those features are included in our latest versions of eClinicalWorks V10. So if they want these ICD-10 codes, they're in their version 10 for an upgrade. She said also the customers can turn on ICD-10 for each payer individually, so the delay just means they won't turn on that feature a bit longer. From a practice standpoint, the delay in ICD-10 gives them more time to learn the different codes. And that was an email direct from Heather. So that's about all I have in terms of what the upgrade, the effects of the upgrade, ICD-10 delay is on the upgrades for each of the vendors, and sort of gives you a background on the good and the bad and the positive and the negative. I'd like to now open up the floor for any questions or concerns. So are there any questions? Well, if you have one later, please feel free to email me at roy.hightower@quirkhealthcare.com, and I'll be glad to help out in any way I can. Dan, I think I'm done here. Do you have anything else to add?
Great. Yep. Thanks, everybody, for attending. We'll post this online soon. Have a good day, everyone. Bye.